cause of death was listed as undetermined respiratory failure. The medical examiner disagreed, identifying severe laryngeal swelling as the central finding during autopsy. This condition indicated a significant obstruction in the airway, necessitating a thorough investigation into potential mechanisms leading to such an extreme level of edema. Initial findings suggested that the deceased had likely experienced acute allergic reaction or anaphylaxis, though no direct allergen was immediately apparent. The absence of clear environmental evidence presented a critical gap in the forensic record for this case. This gap is the case: severe laryngeal swelling obstructing the airway, with no definitive cause identified beyond potential allergic triggers. Further analysis revealed microscopic signs consistent with an intense inflammatory response, underscoring the need to re-examine all available environmental and medical history data to determine a precise etiology for this fatal condition. Chapter: Case Background. The incident occurred on the evening of March 15th in a suburban residence within the city limits of Springfield, Illinois. A neighbor reported noticing unusual activity at the property when they observed an open window and the sound of persistent coughing emanating from inside. The caller also mentioned that their attempts to communicate with occupants through verbal contact were met with silence, prompting them to alert local law enforcement immediately. Upon arrival, officers entered the premises after obtaining forced entry due to concerns for welfare checks. Inside, they found the deceased in a reclined position on the living room floor, exhibiting signs of distress, including a pale complexion and an audible wheeze from the respiratory tract. The initial assumption was that the individual might be suffering from an acute allergic reaction or asthma attack, leading to immediate medical assistance being called for emergency resuscitation efforts. However, these attempts were unsuccessful, and upon further inspection by the coroner's team, it became evident that the primary cause of death could not be determined at the scene without a thorough forensic examination. The deceased was subsequently transported to the morgue for autopsy procedures. Chapter: Initial findings upon arrival at the scene. First responders noted a male adult positioned supine on the floor within a closed bedroom environment. The room was moderately warm and no immediate signs of trauma were observed. A nasal cannula was in place but not active. However, there was evidence suggesting recent use. Observations indicated spontaneous respiratory efforts with diminished breath sounds upon auscultation. Initial medical assessment revealed marked cyanosis around the lips and fingertips consistent with hypoxemia. No external injuries or defensive wounds were present on gross examination. The scene lacked any obvious signs of foul play. Given the severe appearance of laryngeal swelling noted during primary survey, further investigation was warranted to rule out obstructive causes of asphyxia. The initial manner of death was classified as undetermined pending autopsy and toxicology results. Chapter: Forensic investigation. Upon arrival at the scene, the medical examiner conducted a thorough examination to identify potential causes of death related to asphyxia due to laryngeal edema. Physical evidence included nasal and oral secretions consistent with respiratory distress. Notably absent were any foreign substances that could have induced allergic reactions or direct trauma to the airway. Swelling in the vicinity of the larynx was evident upon external examination, necessitating further internal inspection during autopsy. The chain of custody for collected samples, including tissue from the hypopharynx and epiglottis, was meticulously documented to ensure integrity and prevent contamination. No unexpected substances or signs of forced entry were identified at the scene, supporting a natural cause hypothesis pending toxicology results. The laboratory analysis involved comprehensive testing to assess the presence of allergens and inflammatory markers contributing to laryngeal edema in the deceased. Blood samples were analyzed for serum levels of histamine, tryptase, and specific IgE antibodies, indicative of an allergic reaction. Immunoassays detected elevated levels of histamine at 120 ng/ml and tryptase above baseline thresholds, confirming acute inflammatory response. Tissue samples from the larynx showed extensive edema with neutrophil infiltration on hematoxyliniacin staining. Microscopic examination revealed thickened basement membranes and increased perivascular lymphocyte aggregates consistent with allergic inflammation. Histological sections indicated swollen mucosal epithelial cells and disrupted lamina propria structure, confirming severe acute laryngeal swelling leading to airway obstruction. The timeline reconstruction for this case relied on a comprehensive analysis of forensic evidence to establish the sequence of events leading to the deceased's demise. Analysis of the laryngeal edema indicated an acute onset, consistent with exposure to allergens or irritants approximately 2 hours prior to death. This timeframe was corroborated by toxicological findings and environmental factors at the scene, such as the presence of known allergens. The postmortem interval, PMI, estimation utilized entomological evidence, indicating a PMI of 12-24 hours, which aligned with witness statements regarding time of last contact. Forensic documentation confirmed that the deceased experienced respiratory distress due to laryngeal swelling and likely succumbed within minutes to asphyxia secondary to airway obstruction. This timeline contradicted initial hypotheses, suggesting a slower progression of symptoms or alternative causes, such as poisoning or infection, reinforcing the conclusion that severe allergic reaction was the primary cause of death. In this case of suspected asphyxia involving severe laryngeal swelling, forensic examination revealed significant edema in the larynx, obstructing the airway and indicating a likely cause of death due to respiratory compromise. Microscopic analysis confirmed an acute inflammatory response consistent with allergen exposure or toxic inhalation prior to death. The presence of foreign substances within the deceased's lungs further corroborated this finding, suggesting an environmental trigger for the swelling rather than natural causes. While the severe laryngeal edema is unequivocal evidence of respiratory obstruction leading to asphyxia, interpretation of specific causative agents requires consideration of contextual factors and additional toxicological analysis. Under oath, I would affirm that the combination of anatomical findings, microscopic examination results, and environmental evidence strongly supports a conclusion of death by an obstructed airway secondary to acute laryngeal swelling. Chapter Resolution. The final determination in this case is consistent with death due to laryngeal edema resulting in upper airway obstruction, leading to asphyxiation. The evidence unequivocally established severe swelling of the larynx, which occluded the trachea and prevented adequate respiration. This central finding was substantiated through comprehensive microscopic examination, revealing marked infiltration of inflammatory cells within the mucosa and submucosal tissues of the larynx, indicative of an acute allergic reaction or foreign body aspiration. The evidence unequivocally established severe swelling of the larynx, which occluded the trachea and prevented adequate respiration. From the initial assessment, there were inconclusive signs pointing towards natural causes due to the absence of external trauma. However, further histopathological analysis confirmed the presence of allergens specific to environmental irritants in the vicinity of where the deceased was found at time of death. This shift in understanding highlights the critical importance of detailed microscopic examination alongside clinical findings for accurate forensic determination. This case underscores the critical importance of detailed autopsy procedures and comprehensive toxicological screenings in asphyxia cases. Severe laryngeal edema may obscure primary causative agents, necessitating thorough histopathological examination to rule out anaphylaxis or chemical irritation. The file remains open,